Good afternoon, folks. And once again, I want to start by emphasising the fact that COVID-19 is still continuing to claim lives here in Northern Ireland. Today, a further 12 COVID-related deaths have been reported in Northern Ireland, and my heartfelt condolences go to the family and friends of those who have so tragically passed away. Undoubtedly, we have now entered a new phase of this pandemic. The vaccination programme is now firmly underway, and we can look forward with confidence to a better future. But that is still some time in the future. I believe we're now entering actually what will be a particularly dangerous period of this pandemic. With the vaccination starting, there is a real risk that the defences will start to slip, that some people may worryingly conclude that the battle with COVID is over. In addition, there's a real risk that over the festive season, discipline will slip further. We must not let that happen, because we cannot let that happen. This pandemic is far from finished. Indeed, I'm still very concerned that the next surge in infections could, in fact, be the most aggressive yet. Our health service remains under immense pressure. Staff are already exhausted and are increasingly fearful over what they will have to face in the weeks ahead. But each of us can help ease those fears. Our behaviours will dictate just how well Northern Ireland gets through this critical phase. Cutting down our contacts, keeping our distances, avoiding crowded indoor settings, wearing a face covering and washing our hands. We all have to do it to get through this winter. So, as we rightly celebrate the beginning of the vaccination programme, this is definitely not the time for us to lose the run of ourselves, because we can see a finishing line in the distance. So now is not the time to stumble. We all felt emotional yesterday as we witnessed the beginning of the vaccination campaign. As we watched Sister Joanna Sloan get her injection, it was a huge moment. Our joy and our relief were mingled with pain as we thought of those lives that have been lost already this year. But yesterday we saw our health service rise to the occasion yet again. Just a few days after the vaccine had been approved. In fact, today is just 1 week since the vaccine actually received its approval. The vaccination programme was and is very much up and running. Staff members were lining up to do their bit and lead the way. They have helped make global history, and I am so proud of them and so very grateful. New hope is now being brought to our care homes. Vaccination teams visited the first home yesterday and 2 more today. Frail and vulnerable residents are being prioritised for protection from the virus, and rightly so. Because, of course, the vaccination programme has many more months to run. There will be many challenges and doubtless some frustrations along the way. So patience will be required from many of us. But we are on the way, and I want to thank all those who have worked at pace to make yesterday a reality. Yesterday morning, it came home to me once again how great a debt we owe to our health and social care staff. And I personally reflected on just how much we rely on them. Time after time, they are there for us when we need them. And I know that only too well from my own family's personal experience. And here's the thing. While our health and social care staff are certainly superheroes, they are not superhuman. They get exhausted, and they get tired, and they get frustrated. What they see in their jobs day and daily can and does break their hearts. Yet day after day, they are there for us, and we need to be there for them. We must help our health service and its people get through this winter. The more we push down the infection rate, the more we ease the pressure on our hospitals. It really is that simple. So let's all dig in for a few more months. Let's use the optimism from yesterday to re-energise our determination and our resolve. Follow the public health advice and the simple precautions that can stop the virus spreading. Our health service needs us. Our health service needs you. The staff are relying on us. The staff are relying on you. So please, let's not let them down. I'll now turn to Dr. Michael McBride, our Chief Medical Officer.
Thank you, Minister. Sadly, today we're reporting the deaths of 12 more people in Northern Ireland from COVID-19. I also want to send my sincere condolences to the family and the friends of those that have died. Unfortunately, such news and public statements have become all too commonplace this year, but we should never forget the people behind the figures. That is 12 more families with an empty chair at the table this Christmas. For all of us, this Christmas will be one like no other. Even if you've not lost a family member or friend, this virus has cost too many lives and too many livelihoods, and we will all feel the presence of COVID-19 this Christmas like some uninvited guest. There is, however, only one thing more infectious than the virus, and that's hope. I believe we can now look forward with optimism to a time when, with vaccines and better treatments, that we can look to COVID-19 being a more manageable disease. Yesterday was a truly momentous day, and with the beginning of the rollout of the first COVID-19 vaccine in the world being administered to people right throughout the United Kingdom. Margaret Keenan, an amazing 90-year-old woman from Fermanagh, was the first person in the United Kingdom to receive the vaccine. And she, of course, remains a Fermanagh woman. And here in Northern Ireland, as the Minister has said, we saw the inspirational Sister Joanna Sloan being the first. I had the privilege of speaking with Joanna yesterday morning. I was hugely impressed by her dedication and deeply humbled by her personal sacrifices this year, a story reflected in the experience of so many in the health service in the last 10 months. I want to place on record my sincere thanks to all who have helped us get to this point. Those who volunteered for the trials, the research and scientific community, our partners in the industry, the regulator, the JCVI, and all of those who have planned and prepared for this vaccine over so many, many months. This is the greatest public health challenge we have ever faced. I am confident that we will achieve and deliver because I have absolute confidence in the people who are delivering it. This vaccines and others yet to come are a roadmap out of this pandemic to a more normal life. Today, we heard of 2 adverse reactions to the Pfizer BioNTech vaccine. This is not unusual. Vaccines stimulate the immune system, and sometimes the immune system overreacts. It's not unexpected, and it is common with vaccines. We will, as always, follow the MHRA advice to mitigate any possible risk to health, however small that might be. In closing, I want again to encourage everyone to stay the course. Please do not give up now. For 10 long months, we have talked through our loved ones, through windows and from behind masks, or not at all. For 10 long months, we have replaced the warm touch of a hand with a cold pane of glass. And for 10 long months, we have kept our distance and missed our friends and family. Please remember why you are doing this, and please remember the end has not yet arrived. We have come too far, sacrificed too much, and please, if you think it's over, it's not. Do not let your actions today and tomorrow and in the coming weeks result in an empty chair at your table in the new year. So let's all continue to work hard until the vaccine does the work for us. Thank you.
Okay, I'll now ask Professor Ian Young to provide an update on case numbers.
So thank you. What I would like to do is to talk you through how cases have developed over the last couple of weeks since we reviewed the progress of the epidemic. The first graph shows the average number of new cases per day. And what we see is a steady fall from the peak number of around 70% to a low level. Following the 1 week of relaxation, when cafes were open, close contact services and retail was very busy, we have seen an impact in terms of increased cases. There's been around a 25% or 1/4 increase in cases since that week. That shows, if anyone was in any doubt, the impact of increased interactions between people in a wide variety of settings. We've just begun to see that increase in cases slow, and I hope that we will still see some benefit of the current 2 weeks of restriction as we go through the next 10 days. If we look at local government districts, we see that 10 of the 11 districts show increased numbers in the last week, and that levels remain everywhere over 100, which is relatively high in terms of where we would like the epidemic to be. Demand for testing has increased since the week of relaxation, reflecting the fact that more people will have symptoms and are going to be tested. And we've seen that the percentage of tests that are positive has levelled out. So the increase in cases is not due just to the increase in testing. What about our hospitals? We know that there is always a lag between an increase in the number of cases and the increase in the pressures on our hospitals. Typically somewhere between 7 and 10 days after an increase in cases, we will begin to see an increase in hospital admissions. And sure enough, just in the last few days, we see that the number of hospital admissions, shown as the final points on the graph, have been increasing. We expect this increase will continue for at least another week or so. Along with that, we see a plateauing in the number of patients with COVID acquired in the community in hospital. And even now, the number of patients in hospital remains significantly above the peak of wave 1. Our hospitals and services are under real and continuing pressure as a result of COVID. What then about R? What has happened to it? Well, unsurprisingly, R for cases increased to around 1.2 following the week of relaxation. We've begun to see R settling slowly, and it's roughly 1 at the moment. R for hospital inpatients will inevitably follow, and sure enough, R for hospital inpatients is now above 1 and rising, and we expect will continue to rise for the next few days. What happens with this epidemic is largely predictable. Our behaviours, our increased contacts, lead to increased transmission of the virus. Following that, we see increased hospital admissions, and in due course, increased patients in critical care and increased deaths. The current 2 weeks of current 2 weeks of restrictions have seen a reduction in mobility, a decrease in traffic congestion, as shown in the last column of this graph. However, the amount of mobility, the amount of mixing, looking at a variety of sources, still remains far above the levels that we observed during the lockdown of Wave 1. We're really grateful to all of those people who have been staying at home and reducing their contacts, but not as many people have been doing that as we would have hoped or wished, and therefore we're not going to see the full benefit that we hoped for from these 2 weeks of relaxation of restriction. What then about Christmas and the run-up to Christmas? Following Friday, there will be a range of relaxations and various sectors of the economy will be opening. We know that people will want to get out and about, to meet friends, to visit shops, to visit the hospitality sector. What I would say to everybody is that if you do that, if you expose yourself to increased interactions with other people, you will increase your risk of getting the virus. So we all need to think carefully about what we would wish for ourselves and our families. Anyone contracting the virus from now on is likely to have to self-isolate with members of their family over the Christmas period. It will not be possible to enter a Christmas bubble safely if you catch the virus from this weekend onwards. The best thing you can do to protect yourself and your family this Christmas is to reduce your contacts in the next 2 weeks in the run-up to that period. Think carefully about what you are doing, where you are going. If you want to meet with people, it is much better to meet outside than inside. If you're meeting people indoors, if you can reach out and the other person can reach out and you can touch each other, you're too close. In order to protect yourself and your family, you should be further apart. As Minister has indicated, we are entering a potentially difficult and risky period. This season is the peak for viruses like the COVID virus, and we often see the largest number of admissions, the greatest hospital pressures early in January and February. We all have a role to play in order to reduce the chances of that in the weeks to come.
Thanks, Ian. Hi, Sharon.
How are you doing? Sorry about that. I always have my mute button on.
Yeah, you're okay.
Minister, can I ask you, you spoke there about a third surge quite comfortably as if it is going to happen. We have been told that health officials are planning for that third surge in January. Can you confirm that?
Certainly, Sharon. I think I've used that myself. I've confirmed that myself because it would be irresponsible of us not to plan for that third surge, where we see the number of cases currently, and Professor Young has went through the data that we have, the numbers of inpatients, the number of people we still have in hospitals, the increased rate of transmission. That third surge is something that we must prepare for. It is not inevitable. There is still a large power that relies and rests within the hands of the people of Northern Ireland. And again, Ian has made that very clearly. The more contact we have with each other over the next coming weeks, the more pressure and the more likely that surge will become a reality. So I think from my point, the ask is that we do follow all that guidance. We cut down the number of contacts that we have over the next few weeks. We maintain social distancing, good hand hygiene, good respiratory hygiene, and for the sake of the next few weeks, Sharon, when we have the opportunity of the vaccine so close, it would be a shame and a disgrace that if we were to lose the real benefit and the real potential that brings by just a few careless actions and a few meetings too many over the next 2 and 3 weeks.
On those contacts, Minister, there has been a rise in transmission in most of the local council areas. Obviously, we saw the images of the Christmas lights switch on there in Lisburn, and it had to be cancelled because of a huge number of people. Are you advising councils to rethink their plans and in relation to the likes of markets and such?
I would, Sharon. I would ask, and the one thing I will do, I would like to acknowledge what Lisburn did over the weekend when they saw the crowds that were appearing, that they did take the proactive steps and actually cancel that event. What I would say to other council and civic responsible leaders, if you are organising an event that brings people together, as Ian has very clearly laid out here in his contribution, the more people gather together, the more chance there is of this virus spreading. So for the likes of light switch-ons for Christmas markets, there's a huge risk that also comes with those events. So I've been in contact with some council chief executives this afternoon, asking them to consider some of the events that are already in their calendars. Just anything they can do to help us in regards to breaking down the opportunity for this virus to spread over the next 3 weeks will be beneficial. 3-4 weeks, will be beneficial to us, will be beneficial to our health workers, and beneficial to the people of Northern Ireland. I don't know if Michael or Ian wants to.
Yeah, thank you, Minister. Just to build on that, we've said this time and time again, the most important thing that we can do is to reduce the levels of transmission of this virus prior to Christmas. We are not where we need to be. Because you can do something doesn't mean to say you should. Everyone needs to be responsible. You need to reduce your contacts in the run-up to Christmas. Otherwise, you'll end up self-isolating over the Christmas period with your family. And also, if you're asymptomatic and carrying COVID, you risk your family members who are in the Christmas bubble. So please be responsible.
Okay, thanks, Sharon. Hi, Louise.
Hi there, how are you doing? Just the first question, Minister, about the announcement you made earlier today about nurses' pay that they're getting a year after they were standing on the picket lines. They're now going to be getting that pay that they lost. This has taken a very long time. Can you reassure them about how quickly they may get that money now?
Well, I think one of the things that I do want to put into perspective is my thanks and acknowledgement to all our healthcare staff right across the health family and the Herculean efforts that they've made over the past 10 months. I was clear from the beginning in regards to the reimbursement of the strike deductions. It's something that I wanted to see done. We received the transfers of money earlier this year, but I wanted to ensure that legally and procedurally it would have no repercussive implications to the Department of Health's budget going forward. So I got that reassurance actually towards the end of last week. I'd made it clear to my executive colleagues at our meeting on Thursday that it was in the pipeline. So when I received executive approval yesterday to start that process, we've immediately done that. In regards to how quickly we can get it out there, because of our December payroll is processed earlier in the calendar month rather than usual because of the festive season, it will be challenging. Our business service organisations are working to see if that can be done. They are hopeful that we will be able to make the majority of those reimbursements in the December pay, and I'm thankful for them doing that, but there may be exceptions where that's not possible. But the money's there, the will's there, the executive approval there, and the legal sign-off is there, so that decision has been now made and is being processed.
And just a follow-up about care homes, the Chief Medical Officer there, Dr McBride, talked about 10 long months of talking through glass panels and windows and being kept apart. Is there any consideration being given to visiting and regulations, or any changes that may be made over Christmas to allow some families to have what sadly for some could be the final Christmas they have together as families?
Yeah. Louise, in our guidance to the visitation of care homes, we've always made sure and tried to lay out it as clear as possible that where it is safe to do so, those visits are facilitated by care home owners and their staff. We will be issuing updated guidance in specific over the festive period later on today, but I don't know if the Chief Medical Officer maybe wants to provide some more detail on that.
Yes, thank you, Minister. We will be issuing detailed guidance set based on the best assessment of the risk. The risk doesn't go away at Christmas. The people in our care homes are extremely vulnerable. It is important that in visits over the Christmas period that they were in line with that guidance, and we go through a series of detailed advice to both care homes themselves, but also to family and to relatives. We really are, as the Minister has said, we are so close to getting this vaccine rolled out to protect as many vulnerable people as possible. We've started the rollout in our care homes and amongst care home staff because they are the most vulnerable. We need to keep them safe a few short weeks and months until we can get them vaccinated.
Okay, thanks, Louise.
Good afternoon, Tara McLaughlin, Downtown Radio, Cool FM. I just want to ask you a bit more about the vaccine. Can you tell us any more details about the amount of people that were vaccinated yesterday, and do we have a breakdown as to how many were care home residents, how many were health and social care staff?
I don't have the full breakdown, Tara, of all the numbers, but what I want to be clear is, this is the first batch of the first vaccine, so it is about a measured control rollout of the programme to ensure that we don't waste any of the vaccine that is there. Yesterday we vaccinated our first care home residents and staff, and there were a region of 60, both staff and residents in that. Today, in the two care homes that we've visited, is in the region of 250 staff and residents. So out of the total, we've actually 310 staff and residents over the past 2 days. And when we put that into perspective, as I said in my opening comments, this day last week, I was standing here with the First and Deputy First Minister at the point where we'd just actually been able to say the vaccine had received approval. So in the space of 7 days, the health service in Northern Ireland has brought itself together, has mobilised itself within 6 days, where we were actually out vaccinating care home residents and staff who met that priority group that we said as an executive that we were committed to doing in the first phase of the vaccine. So it's an amazing step, it's an amazing achievement, I think, for the health service of Northern Ireland, and it goes to show the preparation that members of my department and staff across the trust had already been putting into place for when we received this vaccine. But I do want to make clear, and I think it's something that we should stress, this is the first batch of the first vaccine. So although the programme has started, it is still a long way to run before we see the real benefit that this vaccine can bring.
Thank you, Minister. And I want to pick up on that because we know obviously that the 9 priority groups have to be prioritised, but is there any indication as to when the most vulnerable people may be completed, the vaccination programme, when it may be offered to the general public? And also, do we know any more about any of the other vaccines? We're hearing rumblings that the AstraZeneca Oxford may be approved soon.
Yeah, well, I'll let Michael and Ian pick up on the specifics of those vaccines. But look, in regards to our programme itself, our phase 1 was the 2 priority groups, the first 2 priority groups, care home residents and staff, and the health and social care and staff, and those over 80s. So that in itself is a cohort of over 200,000. So it's about prioritising, getting that operationalised, but also having the vaccine in hand. We have our programmes, we've started that programme, but we do need to receipt of a vaccine before we can do it. Our phase 2, which moved into groups, I think it was groups 3 to 7 were moving in that phase 2, which was looking at the start of next year, January, February, March, takes into account the over 65-year-olds, vulnerable people under 65, extremely vulnerable, and those moderately vulnerable. So you're talking about another 450,000 in that group. Spring, early next year, we would be hoping, it's the priority groups 8 to 10. That's those over 50-year-old who haven't been already vaccinated, the over 60-year-olds who haven't been vaccinated, and as I say, the over 50-year-olds. You're talking about another 360,000 people there as well. So it would really be into the summer of next year before we're looking into the mass vaccination programme of those people who don't fall into the first 10 priority groups. But what we've seen out of the vaccine, the Pfizer vaccine, we're doing that repeat, will be done in 21 days, and then looking for another 7 days after that. So we'll start to see the benefit of the initial vaccines within 28 days. Actually, from yesterday, we'll start to see the real benefits of the start of that vaccination programme. Michael or Ian, do you want to pick up?
Yeah, thank you, Minister. Maybe firstly, and I'm sure Ian will wish to comment as well. Obviously, this is at the start of a very planned, detailed rollout of the vaccine, the first vaccine, and it is critically dependent on the production and supply of that vaccine. We stand ready, our health service stands ready, our primary care teams stand ready to administer this vaccine as soon as it becomes available, as we have demonstrated already. It is important to bear in mind that this is about protecting the most vulnerable and saving lives, and therefore we will follow the JCVI advice and guidance in relation to the priority groups, and that's where we've started with those in care homes and with care home staff. The evidence from this virus suggests that the risk of severe disease, including death, is largely relates to age, but also relates to those with underlying health conditions, and indeed the JCVI advice is quite clear and quite specific in terms of where we should start and then who we should vaccinate next as vaccine supply becomes available. As Minister has indicated and as you've asked, there are many, many more vaccines. The UK Government has purchased, on behalf of all parts of the United Kingdom, 357 million doses of 7 vaccines. We have yes authorisation of 1, and the AstraZeneca vaccine is currently being actively considered by the MHRA. I hope that following that very rigorous assessment that will be available to us in the not too distant future. Obviously, that vaccine does not pose the same logistical challenges as the current Pfizer vaccine, and that will allow us to proceed at scale and at pace with the vast majority of the vaccination programme, which will be delivered, as most vaccination immunisation programmes are delivered, by our colleagues in primary care and primary care teams. So again, we are actively exploring interim arrangements where we can ensure that we can get the vaccine to individuals in the community. But as I say, the AstraZeneca vaccine, if approved, would be a game changer.
If I could just add a couple of points. Firstly, we're sometimes asked, when do we expect to see a significant impact on the epidemic as a result of vaccination? Because of the timelines which Minister has referred to, the need for 2 injections, the fact that immunity does not develop for 1 to 2 weeks after the second injection, we don't think that there will be a significant impact on transmission of the virus, the epidemic, for at least 3 months and potentially as long as 6 months. So this is absolutely not the time for anyone to let their guard down, despite the fact that we've had really good news about the vaccine in the last week. The second point is that for this to be effective in terms of reducing transmission of the virus, we need a high percentage of those who are offered the vaccine to take it up. And we need as many as possible and as close to 100% as we can get of people who are offered the vaccine and are eligible to receive it. I know that there's information circulating about concerns around the safety of the vaccine. What I can say about that is that it's something I'm looking at extremely carefully, as the CMO is as well, in terms of all of the information available. I will have no hesitation whatsoever in taking the vaccine whenever it's my turn, and no hesitation whatsoever in recommending it to members of my family whenever it's their turn.
He may have to get behind me, however, because I think I may be a little bit ahead of him in the queue.
Rebecca Black from PA Media. Wanted to ask, in light of the rising case numbers and the R number remaining stubbornly high, it does appear that the circuit break hasn't really been as effective as you may have wished. How comfortable are you about hospitality and close contact services reopening on Friday?
I think, Rebecca, what we've yet to see is actually the full effect of the 2-week circuit break, because as we've said before, it does take about a 2-week lag period before we actually see that in the case of infections, which will be followed by hospitalisations. So, as Ian has pointed out, we are concerned, and I think your phrase is right, those numbers of inpatients remain stubbornly high, and that would be the concern of us. In regards to opening other sections of society and the economy, there has been an intense piece of work performed between representatives of those sectors to make sure that they reduce as much risk as possible. But I think, as we've said clearly here, how we manage that risk even further and how we cut those chains of infection is by fewer people actually being and coming together. So the fewer people we have together, the less there is of the transfer of the virus. So it's about following all the guidance that we have in place and observing specific guidance and regulations that are in place for certain sectors who will see some of the relaxations coming into place on Friday.
Okay, and also I wanted to put to you, the Chief Medical Officer in the Republic of Ireland, Dr. Tony Holohan, spoke earlier this week about discouraging international travel and essentially telling people who live abroad not to come home from Christmas. Would you concur with that message?
I'd maybe let the Chief Medical Officer comment and other Chief Medical Officers' comments.
Thank you, Rebecca. I haven't seen those comments, and I don't know what context those comments were made in. What is vitally important is that everyone who is planning to travel or come home at Christmas follows the advice and guidance and the restrictions in that particular country or that particular administration. We've worked very hard across the United Kingdom to get coordinated advice and guidance to people over the Christmas period. People will make their own choices, but it's important, as Minister said 2 weeks ago, that we provide a framework that when people come together, that they come together with as little a risk as possible. And that means, again, emphasising Ian's point, reducing your contacts now in the 2 weeks running up to Christmas, so to reduce the risk of you acquiring COVID and to reduce the risk of you passing it on to someone you love over the Christmas period.
Thank you.